Welcome to this first module of the Health Diplomacy series. My name is Mary Secco, and I am the Chair of Global Advocacy for the International Bureau for Epilepsy. It is my distinct honor to be able to walk you through this e-learning module, which was developed to introduce you to concepts in health diplomacy. The learning outcomes for this module are to understand that diplomacy is both an art and science, and to provide you with examples of the politics of health diplomacy. So diplomacy can be considered both an art and a science. The art of diplomacy is dealing with people in a sensitive and effective way. The art of diplomacy is establishing goodwill. But diplomacy also requires skills. It requires the skill of managing relations and gathering information. It requires the skill of conducting negotiations within a range of settings and on many different subjects. A person who is diplomatic is careful and thoughtful in their interactions with others. They are careful that they do not say or do things to offend others. They understand the importance of establishing and maintaining positive relationships. They are well prepared and think about what they are going to say in advance of their meetings. Health diplomacy engages all branches of government and non-state actors to find solutions to health problems. The art and science of health diplomacy is used at the local level in our meetings with hospital administrators, elected officials, and policymakers. Health diplomacy is an important skill that is used at the national, regional, and international level. You will often hear that IBE is a non-state actor. A non-state actor is an individual or an organization that has significant political influence but is not allied to any particular country or state. Unions and foundations are also non-state actors. IBE is also an NGO, which is a non-governmental organization that operates independently of any government and is typically one whose purpose is to address a social or political issue. So IBE and its chapters have significant political influence because we represent the 50 million people with epilepsy. We are also a part of civil society, which are organizations that promote the common good. Civil society promotes equity and human rights. At a local, national, and regional level, IBE and its chapters can leverage our role as a non-state actor to defend the human rights of people with epilepsy. We are the voice of the 50 million people with epilepsy. And despite this significant number, we often hear that policymakers, elected officials, and healthcare providers don't care, or they don't know very much about epilepsy. Too often we hear that they stigmatize and discriminate against people with epilepsy. So our role as civil society is to engage in monitoring, lobbying, brokering knowledge, offering technical expertise, fostering inclusion for people with epilepsy. Lack of political will is often cited as the main reason for failing to deal with factors affecting health. Health is a political choice, and politics is a continuous struggle for power among competing interests. So our role as civil society is to meet with policymakers, government officials, both the staff and those that are elected, to help them understand the benefits of supporting people with epilepsy. Our role is to bring the human face of epilepsy to these policymakers and to help them to understand that epilepsy is a treatable condition and that 70% of people with epilepsy could live seizure-free if they had access to a proper diagnosis and safe and affordable anti-seizure medication. So in our meetings, we need to provide solutions and to offer to collaborate to reduce the unacceptable mortality and disability in epilepsy. So knowing this and knowing health is unevenly distributed and many health determinants are dependent on political action and health is a critical dimension of human rights and citizenship, our role is to keep people with epilepsy on the radar of those that can make positive changes in the politics of health. COVID-19 pandemic reinforced to policymakers that health and economic and societal factors cannot always be tackled within national or regional boundaries alone. COVID proved that health makes a considerable direct and indirect contribution to economic growth and sustainable development, and to international security, stability, and peace. So COVID has changed the way that non-state actors like IBE will work in the future. Our global rallying cry is that no one is safe until everyone is safe. Global health diplomacy focuses on those health issues that need the cooperation of many countries to address issues of common concern. So to solve big health challenges, for example, COVID-19, or the epilepsy treatment gap, economic, social, and political partners must join in, and health diplomacy brings them all together. Global health diplomacy refers to the multi-level and multi-actor negotiation processes that shape and manage the policy environments for health. It is always political and is carried out through many different channels. It is highly dependent on the willingness of states to cooperate with one another. And power is also wielded by key actors, such as large foundations, which are able to set global health agendas because of their significant funding. On paper, health should not be political, because people in every country, in every part of the world, deserve good health. But politics does get in the way. And there are multiple reasons that range from ideological to economic to cultural. So ideological reasons include conflict, war, and human rights, and this is inseparable from the negotiations conducted at the UN and WHO. There's also the barrier where people are protecting economic interests and industries, for example, tobacco, pharma, patient data, big data, and patents are protecting their economic interests. Social justice and human rights, for instance, women's reproductive rights, immigration, have a strong impact on health negotiations at the global level, and these factors make it difficult for countries and member states to reach consensus. Leadership in global health is always influenced by the prevailing power relations. Club diplomacy is the concentration of diplomacy between a limited number of actors through their representatives. Clubs can be geographic or ideological. Either way, they are always political. Here are some examples of clubs: the European Union, the West African Health Organization, the Association of Southeast Asian Nations, CARICOM from the Caribbean Community, BRICS, MICTA, G7, and G20. Health is now part of global negotiations related to food, climate, energy, water, security, and humanitarian affairs. National Global Health Strategy is one of the few areas of diplomacy in which countries have drawn up national plans to address a global issue. Investing in a global health strategy enables a country to align their commitments to global health with national health and foreign policies. This is an example of the Swiss Health Foreign Policy. Germany has also announced their 10-year global health strategy. They have identified 5 priorities. Many other countries have identified specific priority areas for engaging more proactively in global health diplomacy. For example, Brazil, Cameroon, Canada, China, Norway, South Africa, and Sweden have publicly made their global health strategies available. This is a partial list of country commitments to health. In meetings at the local and national level, it is important to know what priorities your country has made in health. And you can find this by asking your policymakers, or often they're posted on government websites. So examples, the Caribbean Community, CARICOM, put NCDs on the UN agenda. And although they're not large in population, the Caribbean islands leverage their one vote per member state to make this happen. Brazil has been an advocate for universal access to medicines. India is driving force in global efforts to combat TB and for digital technology. The Russian Federation has been instrumental in putting NCD on the global agenda. Again, it's important that you look at your own country to see what commitments they have made in health. So this module provided a brief introduction to health diplomacy. And the key takeaways from this module are the following. Health diplomacy focuses on those health issues that need the cooperation of many people in different sectors to address issues of common concern. Health diplomacy is built on the development of relationships, partnerships, and collaboration. Health diplomacy engages all branches of government and non-state actors to find solutions to health problems. Health diplomacy is always political. IBE is seeking transformational social change for people with epilepsy worldwide. And the IBE role is to monitor, lobby, broker knowledge, offer technical expertise, and solutions that foster inclusion for people with epilepsy.